this episode of Nurturing Wellbeing with Kurt Kelly, I brought a really good friend in to talk to us about one of the most transformative issue that's hit America, the FFPSA. We're going to talk more about that, the Family First Prevention Services Act. It is a major act that has changed the way child welfare is perceived and funded from the feds, and it certainly puts a lot of requirements on the states. We have a subject matter expert, Teri Saunders of Heartland for Children, one of our leaders in the Florida Coalition for Children, is coming to speak on this. And she has actually grabbed the mantle of this and probably recognized as one of the real experts in this arena. I think you're going to enjoy this conversation because it's relevant for today and for the next, 15, 20 years. So I hope you enjoy Nurturing Wellbeing with Kurt Kelly. Teri, I just want to thank you for spending some time with us today. And I've got to tell you that it was a Tuesday morning. I think it was 2017. And I opened up my computer about 7 o'clock in the morning in my office. And all of a sudden I see a notice that they're going to pass in this continuing resolution, this act called the FFPSA, Family First Prevention Services Act. And I, oh my goodness. And so I began to look at what it was. And by that afternoon, the act had passed the House. By Thursday, it passed the Senate. And by Friday, it was law. And this act, probably compared to almost anything that we've seen in years, has had some massive changes coming out of Washington, D.C. to the different states. And so I'd like for you, I've asked you to sort of champion our stuff here over the last couple of years. And I know that you've immersed yourself in this. You're just the subject matter expert in this, and everyone comes to you on that. And I don't say that to boast. I say that that's a reality. And probably nobody understands it and how it's affected Florida. And so FFPSA didn't actually consider Florida in their thinking. They were looking at all the other states, but it had a real impact on us. Tell us, let's start with, from your impressions as we got started in FFPSA, what are some of the major impacts that it had?
Yeah, so Kurt, there are a lot of them. And so I kind of think of FFPSA as two big chunks of child welfare work, right? One side of that is on placements and placement array, and really trying to have a focus on having children with family as much as possible and in family-like settings as much as possible. And there's a lot of new rules and restrictions around the utilization of group care. The other big chunk related to FFPSA is really around the prevention side and preventing children from being removed from their families and going into the foster care system. So there are a lot of opportunities and challenges in both of those kind of chunks of work. And here in Florida, we had, the privilege of having the federal 4E waiver for many years. And that allowed us to really have a focus and an emphasis and a cultural shift towards prevention early on and for many years. And so whenever we lost the waiver, I think we all mourned that very deeply, and because it meant changes to our systems of care. But FFPSA is an opportunity to kind of pick that back up again now with federal funding stream as well.
And the waiver that we had was a very flexible waiver. It allowed for us here in Florida, that has a unique community-based care model, it allowed for us to be able to place dollars where we needed it. Now, that's really smart. Quite frankly, I went to D.C. and I argued that we don't need to lose this waiver. And they pretty much said, we're not going to be doing any waivers. And they had this in their mind to bring the FFPSA. And while it's a little bit of a replacement, it's actually more bucket oriented. So you get certain amount of money if you do this, certain amount of money doing that. That's how government usually does it. And I think that's presenting a challenge for us too, because frankly, we're having to, unlike a lot of states that weren't even doing this type of work, we're having to undo a lot of the good work we did to get it fixed back in so that we can actually provide the resources for them. I hope you're enjoying this episode of Nurturing Wellbeing with Kurt Kelly, but I'm going to take a break from that just for a second and ask you to help us with one of the greatest tragedies that's come into Florida and help us as we're doing disaster relief for Hurricane Ian. Southwest Florida has been catastrophic. And so what we're doing is garnering the support to be able to support those folks who are loving our children and families. Any support that you could provide for us would be greatly appreciated. Thank you and God bless you. Let's go down the path real quick, like of residential care. There was a real movement for years that said that all residential care is bad. Now, we in Florida understand that it is a necessary and it's a very important area. It's probably more expensive because what you do is you have in these residential care, you have wraparound services, the 24 hours, the locations, you're providing all of that. And this sort of jump at the national level to say that all residential care is bad was just really it was not level headed. It was actually wrong headed. And I think that what they're telling us is we don't want you to use that for first placement opportunities. Let's go through how it's affected our residential care as you've seen it.
Yeah. So, Kurt, we've seen as we've moved under FFPSA, we've seen a lot of instability with regard to our residential care programs. And many of them have converted over to the specified settings that you can still utilize your 4E funding for. But we've really not had the growth in the qualified residential treatment programs that we need to be able to take care of some of our youth that have much more complex needs. And that's been one of the biggest challenges is trying to sort out how are we going to make sure that there are adequate daily rates for these services, both on the room and board side, but also on the clinical side. And how do we make sure that the children that have very complex needs have all of the supports that they need and that our programs are designed to help them. So this has been one of our challenges and we still have a lot of room for growth there.
And enter COVID came along with all of that, which I don't know that if anybody's really thought through this process, but at the acuity level, at what we're seeing that are coming into care, um, many times they've got to have these wraparound services. So I've always told our residential care organizations, we love you, we care for you. Make sure you understand what we have to do to put ourselves in a position to draw down the right dollars to provide those resources. But also, let's adapt to what the federal government's looking at and trying to make sure that we're providing those right services in the array of services. I think that that's an area that's going to continue to mature. They had the whole QRTP, which is an interesting process, and I don't think anyone nationally is really working at that level. I think Florida was getting better at it. The other side that I do want to move us into is the word prevention. The Family First Prevention Services Act, word prevention is highlighted. I have looked at the community-based care model that we have in Florida. Because we had that waiver, we were actually doing much more upstream in the prevention area, which is one of the reasons we began to see the numbers precipitously drop initially from the number of kids in care. That means being removed out of their homes and put into care. We began to be able to keep them in their homes, or in many cases, get upstream even before they get too acute and have these problems and be removed out. Let's talk about what FFPSA is. I know their intent. Let's talk a little bit about the whole prevention aspect.
So with FFPSA and their prevention, it's really about preventing children from coming into foster care. So you have to keep that
That's
in
a good
mind.
thing, by the way.
Right. And it is a wonderful thing.
Right.
And what the federal government has said is that you can utilize federal funding for dollars to provide these services to families to prevent children from coming into foster care. The catch is that it's not for any service or any, concrete support or those types of things that we've learned under the waiver can be very helpful for preventing kids from coming into care. But the dollars can be spent on evidence-based programs that are either mental health treatment, substance abuse treatment, or in-home parenting programs. There is a rigorous process for reviewing all of those programs and a system that's been set up with a clearinghouse where these programs are rated and they're ranked as well supported, or promising. And so there's a list of programs that you can choose from with regard to funding those services.
And that was one of our concerns initially. You say there was a list, but it was really minimal list initially. And we have a lot of, now I think over time, you're going to see more
Right.
opportunities for folks to meet the clearinghouse and give us opportunities. But even in that, that means there's scarcity of programs. Anybody knows economics, scarcity of programs means greater cost.
Yes.
And and quite frankly, I think that what we had when we had the flexibility of the 4E waiver, like you said, we were able to use programs that may have been promising practices, good things that hadn't quite gone through all the rigor of the evidence-based programs.
Right.
And so it's interesting to see us sort of. We had to take a little bit of a step back to work in that. I think we're continuing to work in that area. We'll see a lot more. Now, let's talk about the other area that I am really excited about what you're doing, because one of the things we've wanted to do is to get those who have had lived experience into this process. And you have been sort of one of the leaders to take that on. That's what I love about our community based care model. We have such innovation, and you have been really an innovator in that area. Talk to us a little bit about uh, your parent association or your organization that you put together.
Yeah, so we actually, I'm very proud of this. We have a parent advisory council, and I want to tell a little bit of kind of context and history of how we got to this place, and then I'll talk a little bit about what we've been able to accomplish over the last year. So I am. I love my statistics. I'm a researcher at heart. I'm a data person, data geek at heart, right?
Yes, you are.
And so one of the things that we do at Heartland for Children is we do a lot of surveys of different consumers of our services and or stakeholders in our system of care. So we have our annual foster parent survey. We have an annual survey of our relative and non-relative caregivers. We have an annual survey that goes out to our contracted providers and then our community stakeholders as well. And we also, whenever we set all of that up, I wanted to have an annual survey of our parents in the system of care as one of our biggest consumers of services. And we tried for years, Kurt, to get a, a valid sample of surveys from our parents. We tried all different types of methodologies. We would try mail out surveys, we'd try telephone surveys, case managers dropping them off. We had our parents' attorneys handing them out, and they had a place where they could drop them off at the courthouse. And nothing generated a viable sample that was representative. I mean, we may have 2,000 parents and get 5 surveys. It was just ridiculous, and it just wasn't working. So finally, I kind of said, all right, that's a waste of our efforts. We're going to put that on hold. And so we did. But in the back of my mind, I kept wondering and thinking, how do we tap into how they're feeling and get their perceptions around how we're doing as a system of care? So finally, I kind of, this was about a year and a half ago, I was like, all right, maybe I give up on the survey approach and getting everyone's voice, and maybe we try and create a parent advisory council. And knowing that it won't be representative of everyone, at least maybe we can start to get that voice. And I'm so glad that I did that. I actually, I talked to Jess with Casey Family Programs and said, could you help us support this to launch it? And she jumped in and said, absolutely. She had Corey Best partner up with us and assisted us in kind of thinking through structure and how we wanted to organize ourselves. And they actually helped to support through Corey's consultation and also funding the stipends for our parents to participate in the Parent Advisory Council. That kicked off in May of 2021, and we've been having monthly meetings since then, and it's been amazing. The way we've structured it is it's myself and April Roll, our Chief Quality and Legal Officer, that meet with our Parent Advisory Council once a month. It's on a Thursday evening, 6 to 7:30. We were intentional about making sure that it was only 2 of us from the system, because we wanted to make sure that our parents outnumbered the professionals in the room. And I specifically selected April because in her previous role, she was a parent's attorney. And I knew that she had had a lot of experience working closely with parents and representing them and getting in relationship with them. So it has been really wonderful to be able to develop those relationships with our parents. And early on, we were like, all right, we want to hear anything and everything, the good, the bad, the ugly. And we're here to listen for actionable items and things that we can do to modify our system to make it more user friendly and more parent friendly. So one of the first things that came up was we have, for our families that are in the system due to addictions, drug testing is part of the protocol. But our agreement was with the courthouse for drug testing, which had limited hours, and there's all of the hassles of parking and going through the metal detectors to go into the courthouse and do your analysis. And they simply said, can you, it would be great if there was somewhere I could go that, and do that in the evening or on the weekends and outside of those 9 to 4 hours that drug testing was operated. So we did some research and contracted with LabCorp, and off we go. So, that was our first little system change, and they were so thankful of it. Then we started listening to them, and they were like, you know what, I need a DCF data dictionary. And we're like, okay, we can make that happen. And that kind of evolved into us creating a parent portal where
Oh, awesome.
it is a place where there are resources for parents who are coming into the system. We created a QR code. So all the CPI has to do is say, here, follow this link or use this QR code, and you're going to find out all kinds of information. Because what we quickly realized in our conversations with our parents was that there was a lot of basic information about the system that they just didn't know.
And therefore they're intimidated by it and will not access properly.
Right. So we created our parent portal. We also told them as we were coming up on June, we said June's National Reunification Month. We think we should be celebrating it. What do you guys think? And they said, absolutely. That turned into our very first Reunification Month celebration in the park. And we had families that had been reunified and families that were nearing reunification, and they wanted to give inspirational testimonials for people who were on their journey. And they did that. And we gave out reunification awards to a peer navigator that had been instrumental in a couple of these ladies' lives and helping them in their recovery journey and helping them on their reunification. So we have been able to take what we're hearing and, make changes immediately in our system of care. And it's been wonderful. And we have 3 of them here at the conference today.
Oh, is that right?
Yes.
Awesome. So here's what and a lot of people don't understand. As a situation takes place, the Department of Children and Family comes in, takes an assessment, and decides to remove those children. Those children are moved into a system of care that we try to make it as kind and gentle. But I can tell you, most of them said, I'd rather be with my family, but they can't be with their family for safety reasons, for what other reasons. And so what you're doing is now learning from the parents. You're having them teach us how they're dealing with their tough situation, how we can better meet those needs instead of just presupposing we know this or putting a guilt trip on them, just get better type of thing. You're going in and you're helping them. You're actually changing those lives so that the children then can be reunified. And that's what the FFPSA was envisioning, is that we would have less kids in care, what we call the deep end of the system. I want to tell you, every time a child is removed out of care, even if it's done for the right reasons, they're traumatized. So our desire, I think, and this is where Florida, I loved what our speaker said today. They're watching Florida. Why? Because we've got a bunch of Teris all over the state. They're not quite doing it like you, and we're going to learn from each other. We're going to learn from all of this. The coalition that's what we do, is we try to bring our folks together. We can learn and say, look, you don't have to reinvent the wheel. Look what she did here. They may have a different experience in Miami. And I know they do stuff like this in Miami. So I'm very excited. I'm very excited about that learned experience that we're learning from folks. I think the legislature is very interested in that this year. We had a lot of support from the legislature. Unfortunately, right at the end there, the bill didn't pass. It came out of the legislature, and we're gonna look at doing more of that. Teri, you've been an unbelievable leader in the FFPSA implementation. Thank you for leading Heartland. You're the CEO of a very, very important lead agency in Florida, and considered one of our leaders in Florida. Appreciate your time today. Come join us.
Thank you, Kurt.
It's always great to have such great experts that understand the areas of where we are and where we're headed. Our whole conversation about prevention. Teri has just done a major work. I'm thankful that we have such great members in our organization. And I'm also thankful that we have a lot of folks that are looking to Florida as we are strategically aligned to be able to help in developing the right strategies and processes for FFPSA. So with that, I hope you've enjoyed watching Nurturing Wellbeing with Kurt Kelly.